we look at the different measures the way the Ministry of Health and Sanitation don't put in place for treat people we born at the fire explosion. And for can give you that update, I welcome the Minister of Health and Sanitation, Dr. Austin Dembe. Good morning and welcome to the program.
Good morning, sir, to you.
Continue for the week.
All right, the program Good Morning Salon they continue. Don't forget to use it for the listen. The program can send you questions or comments to issues that we discuss. Now the program go now Radio Democracy 98.1 Facebook page or send me a message to the number 0779819881. Well, the first issue we will look at now the program this Wednesday morning. Now outside the Wellington fire explosion will happen this BNTM, make plenty people lost their life and save property them. And from that time where the incidents happen, how the Disaster Management Agency, we now the government institution responsible for disaster prevention and response, don't they handle the issue for respond and self-support to survivor and then victim them? The Director of Communication, now the National Disaster Management Agency, Mohamed El-Bassi, with support from EU, 2 plastic surgeon them, they come salon for handle survivor them, we been born bad one na this incident. Well, Mohamed Elba explain more to Sapsukalon, also a start for explain but the National Disaster Management Agency, the mandate.
Well, as an agency, we're responsible for managing disaster-related issues in the country in line with Ministry of Health, because this type of disaster will get serious medical implications. So we do this in line with Ministry of Health. You know, we don't receive donations from WHO. We therefore do with medical, little over 6 tons of medical, supplies. This morning also, at Lunge International Airport, we don't receive huge, tons of medical supplies from UAE. We and the Ministry of Health go receive now Lunge. And of course, we issue out a release about 2 days ago where we instruct members of the public that whatever donation we, partners and donors and of course well-wishers go on for do, especially, to the Wellington fire victims, and for Channel and through the National Disaster Management Agency. And since then, we don't get massive support from the public and of course from our partners. We don't get meeting with the European Union ambassador and the French ambassador. They don't come talk to we and we don't share with them what really we need immediately, especially for the victims that we hospitalized within critical conditions.
So in terms of the meeting with EU, wait on the thing on a state we on a need, especially for survivor them we still in hospital from this explosion incident.
Well, we need medical support, and we don't tell them say we need serious medical drugs. We get for do with treatment, especially relating to burns. So they don't note that, and they don't assure we say the EU ambassador don't assure we say the Norwegian government don't commit for send huge amount of medical supplies. Then of course also we don't agree that they go for send 2 plastic surgeons from Italy and Sweden. We then say we have come. So we just need for coordinate to the Ministry of Health for make sure say we get clearance and then make them experts and they go in a salon immediately for help save brothers and sisters and lives.
You state about support we go come, we get for do to surgeon them during the meeting again with the EU representative them. When you look at salon, we also know that equipped medically for take care of the kind born situation, right, especially to the level of degree. Yeah. The survivor the way they in a hospital, you will first of all confirm almost survivor them. They they from this fire explosion we happen at the eastern part of the country.
Yeah, as it is at the moment, we get 62 we hospitalized, and out of that 62, unfortunately, we get 32 we in critical conditions in our various hospitals across the country.
Okay, so in terms of the survivor, them you just did say, we get certain amount within a critical situation. We mean say from which you did say more death get for day from the survivor than day from this fire explosion.
Well, that did not go the hand, but we don't get opinions from medical experts that it is possible to say, that number they go increase.
Earlier you state about both local and international support. You don't talk about international support who don't get from EU, Dubai and other side. They will look at the local support. We also get different organizations, Wiki also give aid support and other thing them. So far, what kind of support we they don't give?
The National Disaster Management Agency, we get CTC, we reach out this morning and they offload, 25 kg or 500 bags of rice at the moment. And of course, we also get Kinho Mining Company, we themselves right now don't come with plenty, assorted items, including food and medical items, and also where to go. We don't receive calls from plenty, corporate bodies, institutions, we don't express interest for coming and can donate. And we there and we want for assure the public that we go judiciously utilize, them donations and we account to the public.
So now we'll look at the issue of support to survivor them. How we get for TALEC, because we camp issue of supporting people away na survivor or victim. It can so complex or this particular explosion disaster. How the National Disaster Management don't start a process already for ensure say the one that we really need the support meet them?
Yeah, I think this is a very important and critical question, and of course, I know say this is come out from past experiences because we don't record these disasters in the past where issue of registration of victims being really not been a challenge, and of course, and if you miss them from that point, you miss them right through to response. So we don't learn from that. We don't establish immediately an incident command center at the scene. We currently they do assessment and of course they identify victims and family, lost one and families. We don't go far with that. And the victims that we survive within our hospital, even the one that we before then they passed on, because in night now like 84 bodies will be, deaths will be recorded. So in previous days and now don't lead, more deaths and we don't record more deaths and all. So we be able to collect, some of them, give them names and addresses and then, relatives and all of that, and we suddenly, so then we don't trace them, families them already. So we don't identify quite a number of families we affected by this particular tragedy, and the registration ongoing at the moment, and of course, whatever support we get from the public, definitely we will get for target them. But for now, yes, we get for respond to the families. We equally so predicate so much attention, especially on the one that we critically hospitalized at the moment.
So despite this registration, is it a normal registration or things and don't put in place for ensure say if somebody can say yes, this person we don't die inside this fire incident and be person, on I guess system them in place we could really identify for say yes, this person now in relative with that particular person they don't die inside this explosion.
I'm more accept saying a challenge, because especially if somebody died beyond recognition in such a manner, a difficult really, that make we take the blood samples, the tissue samples, for make sure say we're able for trace. You understand? We also don't involve the community leaders, and we don't see the community side. People them don't begin come out, for give testimonies about, the one them we don't know, say them in the day. We don't involve the Bike Riders Association because we understand the majority of the one will be there around that vicinity. Especially we go for we go for go take fuel, not being Okada riders. So we don't engage the Okada association. They be there yesterday, and definitely, we don't go far in identifying the one that we die.
So for the one that we born beyond recognition, we nobody able to identify them. How una get for do? Because already we don't see an audio where they go around, where people are way not to a victim, they try for begin bypass the system for make sure say them benefit.
Yes, we attention don't be drawn to that, and of course I want to assure the public that nobody no go forget away with we, because the systems that we don't put in place, go really ensure say we track the targeted beneficiaries, in this particular process.
So the support where government don't talk say they get forget. Those kind of support where victim, family member and survivor then get forget.
Well, the victim and the families and we suffer from this particular tragedy. We get for segregate the donations that we don't get, medical donations, and definitely we get for hand them over to Ministry of Health through Connaught Hospital because of the victims already, and then so go distribute and to other hospitals already to get victims at the moment. For the food items that we get, definitely not the family relatives that we get for give.
We know the system or mechanism they want to put in place. We get a coordinated support way for come out from the different local organization them to owner and also to the people them we want to give support to this particular time. What kind of system we want to put in place? So whatever support you come, especially the local support, it be well coordinated.
Well, we don't issue out a release. We don't talk to partners, both locally and internationally, for ensure say what donation that they do towards the victims there for be channeled through the NDMA, and we'd expect the public for adhere to that. And additionally, so far, I want to say we don't get that. Plenty of people they want to donate. They reach out to me. So in terms of coordination, the reason why we established the incident command center, and we say we get a centralized approach towards responding to them to this fire incident. that we don't go do assessments, we know the people, we know the type of, response we need for do. So the issue before now, yes, indeed, everybody go say you get right for go and go donate individually. But if you go there, sometimes then expect anybody go there, all the victims and forget, you understand? At the end of the day, if you go give half, then come in, and then maybe we can. So when I go give them, no way, say something private, somebody go donate. And so that's the reason why we coordinate the response, and we make sure say every victim gets, understand. So now the issue, and we don't get support from our partners.
Well, that's now the Director of Communication at the National Disaster Management Agency, Mohamed El Babidi, talking about that interview there with Satu Kalon. Well, the program Good Morning Salon, they continue, and as we tell you on the program earlier, today at the program, we get the Minister of Health and Sanitation, Dr. Austin Dembi, where they are for counsel. We waiting at the latest information in terms of the situation of the different people within a different hospital in the country after the Wellington fire disaster we been happened last week Friday, where they can get updated information as to the latest developments where don't they happen since the incidents they happen. Well, good morning once more. Welcome to the program, Dr. Dembi.
Good morning, Mabel. Good morning to your listeners as well.
All right, before we can get an updated information as to the current situation and also Osai Salon Day, this particular fight now for ensure say we save the lives of we fellow citizens them. Let me just go back to what happened on Friday, now Wellington, before the fire incident. Well, after that, we don't get different information as to what exactly happened that particular day. They will lead to the death of over 90 people, and currently, other one in our hospital in critical condition, whilst other one they respond to treatment. Let we just know, waiting at the official information where the Ministry of Health and Sanitation don't get as to what exactly happened on Friday last week.
Mabel, that's a very important question, but as you know, say, we're in our Ministry of Health and Sanitation, so we focus now more on the health and sanitation aspect of it. But I think so we'll go there, most of this now, the security sector, because then still they investigate. But I think we're understanding now a truck full of stones being moved from one end of the road and it collide with a tanker full of petrol. When this collision occur, small leak of the petrol begin come, and certain people, and she say, maybe instead of the petrol waste, they want for collect time. So a lot of people then rush go there for go collect this petrol. And in the process, it blocked the traffic from oncoming and departing people there, and a big crowd gathered there as well. And with all this crowd, all you need is a spark occur, and a loud explosion occur, and we get a lot of casualties. So I think we have, right now, we get a total of about 296 people, just under 300 people impacted by this. On the spot, about 84 people then die right away, and about 47 of them died at the hospital. And so right now, we get a total of 131 people we died from this incident.
All right, so from that brief information, the way you don't give listeners them, the Ministry of Health, like you stated earlier, now only for handle the issues we get for do with health and sanitation at the country. I remember way back the shock of Ebola where the country been gets, the hospitals then be overwhelmed as well. We at that time they not be able to handle the situation as expected in terms of preparation. And this one again will happen an accident we will not be the expect. What will be the first response of the ministry when this incident happen?
Well, first, I think we really give tremendous credit to the medical staff in Rukupo Hospital, because the hospital line have been the closest to the incident. We get tremendous credit to the staff of Connaught Hospital as well as Emergency Hospital, then 34 Hospital, and Churcham's Hospital, because now they take the whole brunt of this incident here. So in terms of preparedness, even at the West, even Europe and America, it's very, very difficult for handle over 100 people and show up in your hospital at a point in time. With burns, with some people then get third degree burn, deep burn inside your body. First degree now just superficial burn. Second degree middle side burn. But we get people that we get serious third degree burn, and not only that, they get over 80%, 90% of their body completely burned, and some people then lost their life inside it. But I give credit to the initial hospital here because they all come together. All of the serious cases, then they try for manage, they try for save lives right away. Some people in Eureka, we get minor illnesses, we get minor burns. Then people then are in called working wounded. So then treat them, then ask them for go home, for come back the next day, for get dressing. But I think so at this point in time, all the one that will be need care, then receive the maximum care we Sierra Leone be able to get. Unfortunately, we lost some of them.
You earlier state for say, you make an example for say, even advanced country that we can get such situation, they can get challenged for able handle at a go. From which you say, is it that at that moment the kind mechanism or the kind approach where medical people in for be used the country or then different medical center then they not be get them available?
No, I think say for the circumstances we're able to pull all of we doctor them, the surgeon them, the house officers, the nurses, they all the one that will be there on leave, they all come back. Even people that will not be in call set, they all rush going to the hospital. So we can get adequate medical staff for manage the situation there and then. But as you know, say this now burn victim, a long-term care. So the initial shock we're able to manage, but over time it'll get more complex and we need more help.
So waiting be happen, we be see a video. Also, most of the victim them were born from this incident. Them be some of them then are gone. Somebody walk around the hospital without no help. They be just in that helpless condition.
Well, except in a trauma situation, you get what you call triage. You defend the sickest of the sick and try to contain them. You get the mid-level people that way they try to manage. You get the people that we then can call walking wounded, where they just need bandage, they just need some small care. And so you get a whole triage that take place. Where we go to the hospital, in fact on Saturday, you see a lot of people in our Connaught Hospital on the floor, on the ground, with mattresses on the ground. Then have been deliberate effort because in some of them delirious. If you put them in a bed, then go fet and when they get all them born there, so it will cause a lot more problems. So then put mattress in the ground for you to stabilize the patient and able for work them through. And I think say Daniel have been really good care approach in that kind of emergency. But so following that, we create bed there now. All of the hospital, everybody get their own individual bed and then get their own individual care.
So apart from the bed, in terms of medics for letting people here get, in case of something happen, you want to have first aid treatment for calm you down. Yeah. The hospitals them where they carry them people here so go being capacitated enough for get that first treatment when they go there.
Well, we'll be extremely lucky because they now open a public-private pharmacy inside Connaught. We'll be very, very well stocked with all of the products that we need. So then literally just clear the one whole pharmacy. All of what they may need will be available to them. At the same time, we open up all of the warehouses and all of the material that they need. We deploy them all in the field. So in terms of what people that may need for create that immediate care, the healthcare worker them will get nearly all what they need. But again, that now for the first phase, you need more help going forward.
How you could describe the current situation of the people and where they undergo treatment right now?
Well, right now, as of this morning, it's really important for us to share the situational report. We now the authentic report of what's going on. And I think it's important for us to share that with the media as well. So as of 12 midnight today, we get about 19 cases that were very, very seriously ill at the hospital. 6 of them, they Connaught. 2 day Choitrams and 4 day now military hospital. Emergency hospital get about 7. One in the serious case them. But overall we get about 63 patients now at the hospital we did in different degrees of care. 29 in a Connaught Hospital, 14 in a emergency hospital, 7 in a Choitrams, 11 in a 34 hospital, and 4 in a Rokupa hospital.
And enough medics stay for them one them way, especially you say some born but to the 3rd degree, where they seriously and critically need attention. Then they get second attention the way they need.
So as I described with burn victims of this nature, the care and attention they change over time. So initially you want to stabilize the patient and you want to make sure so you avoid shock and try to manage them immediately. Over time, the care they begin change. You know, you therefore try for look at wound management. You therefore try for make sure say then stabilize the electrolytes. Okay, you therefore make sure that you prevent infection. You know, so I think so right now we get all the team we need for start. But yes, 2 days ago we were very fortunate. WHO sent the first shipment of about 6.6 tons of supplies. Yesterday at Gona Airport I received another 15 tons of supplies from UAE, and we did get supplies from a lot of international and local partners, and really help for manage the situation. But again, this is not long-term care, and the care they change over time.
So apart from the medic supply them when we don't get for get to them survival and a different hospital, let's look at the different well body workman themselves in terms of the approach on handling the different case here, because now a real critical case we salon not normally get for let people get this kind of incident and born to a third degree. Let's look at how much they understand and get to know how for no say this not a different case. The young will self on how they handling different people are when I survive then at the hospital. Very important.
So in a two aspects in everything called capability and capacity. Capability now, how you able to do what you're supposed to do. Capacity now, how many people you get for do the work. I think say we get capabilities on the ground. We get very, very good plastic surgeon, and we get very good surgeon, and we get very good burn expert them. But the number where you need, we not get enough. So now maybe we ask for people then for come in for help. We right now, so they speak. WHO don't reach out to Senegal. We get about 9 experts then from Senegal where they come tonight for can help we. At the same time, EU through France and Italy, they send plastic surgeon, 2 plastic surgeons and other support staff. And we still expect additional people then for camp. Which I did tell, in fact, right yesterday, we get a group from the US, about 11 of them we come for can teach anesthesiology around here. Right now, they just don't deploy, them ready for help. So plenty of people in the where they help. What thing we did say, they want in the way they come for help, then get 2 roles. One role now for help for deal with the situation now. The second role now for help for train and support Sierra Leonean staff within the work with so that then we will for carry on this.
So in this description we just give of the two-way approach on capability and the medical people being capable, which one more get for being needed in addressing the issue of the survivor them still in the hospital?
Not all 2. You need capability, you need capacity. You need people that will get the skills and knowledge. You need the number of them. We don't get doctors the way they work and nurses the way they work 18-hour, 20-hour days. Some people that will not sleep over the past 2-3 days. You need for relieve them. You know, you need for give a break. So now I make the capacity side now the number of people. And so with the 11 Senegalese that way they come, it will help. You know, I mean, we get several plastic surgeons in there. But if you deal with 30, 40 patients that you want in, or not too good, no do, you know, so we didn't get the additional plastic surgeon and when they come and will help we. Again, I'll just remind myself no more that this is not burn care. It will therefore take years and years of rehabilitation. You therefore require physical therapy. You therefore require plastic surgery. You therefore require clinical help. You therefore require psychosocial support. So plenty need there where we get some capacity, we get some capability, but we not get the numbers where you need for manage this kind of crisis. So hopefully the numbers will come, and as I say, then will help for train us more Sierra Leoneans, so we'll get the right numbers for manage this kind of case in the future.
So right now it's safe for we hospitals them overwhelmed?
No, I don't think say that correct, because even yesterday I go Rokupa Hospital, we get beds then we're available. One of the things that we happen, I just need to remind everybody about all the treatment they are free. You don't need for pay anything. Nobody know they ask for anything for let you pay. The government, they put all of these resources available. All of the additional assistance will get available to you. So for example, I go Rokupo last night, you get empty bed them with it. You know, For the walking wounded, the one that we go home or we go elsewhere for their care, you need for come back and report to the public hospital where we'll be able to serve you. And in a lot of cases, there were people now walking wounded where they're able to take care of themselves. They get ambulatory care. You can come in the morning for your dressing and change your dressing and you go home.
Okay.
In fact, that's what we talk with them. They build one new tent outside of Rokupa for just people that are not upset the regular hospital operation. Then they come for change them bandage, for change them dressing them on a daily basis.
The Minister of Health and Sanitation, Dr. Austin Dembi, as there this morning, they give listeners them the latest updates and support so far we Salon gets from different body them, way for ensure say the airplay the one they within a hospital in critical condition, able for recover as fast as possible. Well, we don't listen to reports from Parliament who side and self don't join the nation for Monday one they will die and serve the extend condolence to the family members them also they don't summon people them where them feel say related to issues we get for do with road safety. And as we dey continue for look at this issue we happened last Friday in Wellington, and you don't make mention earlier of the status of the one them within at the different hospitals them, the way how them born you send us then they attend to them, but also as that treatment they continue. You as a minister aware say some hospitals don't begin for discharge some of the patients them from that fire incident?
Yes, and there's no point not if for keep patient in a hospital longer than required. So in some cases, then the hospital authorities think say the patient they're able for move on their own now and is safe enough, then they discharge them. But what should they try for do now? For we know say a lot of the patient in there around Wellington area, and the closest hospital to them now Rokupa Hospital. So we they really try for capacitate the hospital now Rokupa so that they can go able for do wound management and wound care. So if then release people then from Connaught now with the intensive phase of the care done now for just manage them wounds, and you're able to do that from home or from a facility like Rokupa, then go discharge them and then refer them to the Rokupa Hospital where go get care for them. But again, all of the one then we affected by this, if you require wound management, you importantly you go to the hospital and then take care of it. Because I think what's happening, some people then they go to private hospital and they go now find their own care, and we know they stop anybody from doing that. But you get good quality care available to you in the public facility them, and we encourage them people then for use that and they are free, and you get good quality care. All of the guidance with the people that already come for can help we, they usually go situated at them public facility also, and then go offer their help to them.
All right, to just confirm, say, on our accident, left people them way the hospital management and the one the way they work, they know say, then people and they go for manage and stuff if they go out. But also, if you make mention earlier of infection, some of the videos them way we don't see, the one them way you know say they don't left. On a short, then go able to handle the issues of infection where we see bandage on some people, then look like then they in pain. We not go ascertain that. On a short, then go able to manage the issues of infection where then gonna us.
Well, it's very, very important. All the one that we seriously need help, we go hospitalize them. And in fact, what's happening on the first day of the incident, some people have been so severely ill, and the hospital environment been so scary. Some people are not grief for let they admit them. Then family then take them away, And I think so we encourage them and then we go on their own. We self discharge themselves, for comeback for care. And again, if you feel, say, your environment where you're not going to take care of your wound properly, can hospital, we get enough beds, we're going to accommodate them and are free.
Now, the one where the hospital they left at the talk about, the one where the hospital they left, where still sometimes some man get still bandage, where you need for take care of the wound for letting not go be infected. Now they are the ask about.
Yeah. So that one in the way the hospital they release now. Again, I think we get for create a situation where the family within the release them to then get a role for players. So if you well enough for take care of yourself, it's very difficult for lady in a hospital environment. Which would they advise now? Every morning people then come, you treat them, wound them for them, you change them bandage, you give them fresh bandage with them for take home. If it be say serious, if you get second or third degree burns, then they go mean hospitalization. But yesterday we go Narokupo, you really they feel good because like some of the patients are superficial burns and get just surface burns, and the skin don't begin peel now. So you manage that very, very well, and you be able to manage that at home. But anytime you get any hint of infection, now for come back to hospital, make sure so you get good antibiotic coverage, and you make sure so you get good wound management.
So your earlier state say some people take the young people who are victim to a private hospital rather than allow government hospital for treat them. Why you think say people them way survivor of this fire incident rather choose a private hospital instead of government here with all the kind medical facility the way you say available now for take care of the different bonds and where people encounter?
Well, Sapsi, this is not a free country. You get rights for refuse care. In a lot of cases, we do offer the care. We do offer good quality care, but some people then say that they feel they will get better care elsewhere. And we do encourage them to utilize the services of what they provide, but then get the freedom for go elsewhere. And what you they see, they want to way to go elsewhere. Then they come back. We then see say the situation where they feel say somebody go manage them in a private hospital or in a private clinic, then they will meet the task, then they come back. We they encourage them not for do that because you get good capacity, you're able for manage something in case you are so, and now for utilize the services we government don't provide for now free.
So you talk about a surgeon them, or we get a plastic surgeon them, then capable for take care of the situation in the one they will get available in the country.
Yes. You get very, very capable plastic surgeon. I know one or two of them where I don't interact with. We don't do a lot of very complex cases, but yeah, so now you get over 19 very seriously ill. You get over 60 people that we get several degrees of burn. Again, you need not to the doctor no more. You need nurses then for support them. So now we ask more people then for can help. We get people that are capable. But the number is so large and so overwhelming that one person or two people now will do that. So if we get 10, 15 more people who can join them, you get a better team we will respond to.
Quickly, before we take commercial break, professionally, now how long is advisable for letting people here really under care in a hospital before then discharge them?
It depends on the degree of burn. As I say, two things they look for. First, the degree of burn is the first degree burn is superficial burn. The second degree is deeper. The third degree is very, very deep.
So the first degree then
we the fire just burn the skin just peel.
They don't need for be admitted.
You don't need for be admitted. You will get gauze. They'll give you the right proper gauze. The only thing now for maintain the site, let the site clean.
Okay.
We then bandage and go lose the bandage. You make sure say the site clean and can hospital every day. Let they examine them. If they need for change the dressing, they'll change them for you free.
What about the second degree?
The second degree, again, it depends on whose side it depends on the extent of harm. Again, that one they will watch them very, very closely. But the medical advisor will give you on the spot, listen to them very, very carefully. If they want to retain you, then go retain you and then go advise you for be retained, you will get good care. The third degree burn, I think, is important for letting stay in hospital for as long as possible.
Okay, continue for the with a name now. Dr. Austin Dembe, Minister of Health and Sanitation, he therefore talk about the different measures the way government put in place for treat people we born from the fire field explosion we up in this BNTM.
The program Good Morning Salon, they continue with a look at more issues we get for do with support for the one them way they now different hospital now from the Wellington fire disaster, and with a look at the issue now outside the Deputy Incident Manager at the National Medical and Supply Agency, Dr. Moses Batman say the 15 tons of medical supply from the United Arab Emirates go help the treatment of the fire victim them within a different hospital than a Freetown. It talked this way the Ministry of Health and Sanitation go receive but 15 tons of medical support from the United Arab Emirates, where this medical support, according to Dr. Moses, go good at this stage of the response. Musa Kamara gets more, he go reports.
On behalf of the incident management team and the National Medical Supplies Agency for these precious donations. We believe that these precious donations are not only timely, but the quantum provides us with full assurance that we will be able to respond to this.
Dr. Moses Batema, Deputy Managing Director of the National Medical Supply Agency, where they act as the deputy incident manager for Seka, the tanker explosion disaster. They received 15 tons of medical supply from the Ministry of Health and Sanitation, where the United Arab Emirates supports saloon weeds. The 15 tons medical support from the United Arab Emirates, Nawanwe Kaibanya, Chief of Corporate Service, National Disaster Management Agency, say good for the response at this stage of the disaster response management.
Since November last year, we've responded to over 70 disasters countrywide. We've had 2 major fire disasters, the Susan Bay disaster and then the Wellington disaster. We have been coordinating all disasters countrywide. We are very much happy for this gift from the UAE because it's going to be part of our recovery program as we are now in that phase.
But how significant these 15 tons of medical support from the United States Arab Emirates there to the burns victims them? Dr. Austin Demby, the Minister of Health and Sanitation.
When them burn after they recover, they lose a lot of fluids. Important for you replace them fluids, so you get plenty of fluids inside the IV fluids that they use. A lot of the supplies and they cover that. Let the wound heal properly. You get for keep them very, very clean. In fact, this stage is the most difficult part on the care because I didn't tell us now you go get secondary infection. So you need to prevent that. So you get proper antiseptic coverage of all of the exposed area them. So you get Bokuden goes in there. We also get a lot of antibiotics where you give the person so that you don't get bacterial infection.
But waiting at the condition of some of the patients them, Dr. Austin Demby again.
So again, we get a broad range of injury them where we see, some people then get first degree burn. We're not just on the surface no more. Some people then get second degree burn where it go deeper. Some people then get third degree burn, we go very, very deep. And the way they do they say first you measure the degree of the burn. The second way they look at, I will say how much of the body burned. So most times they see 1%, 2%, sometimes 10%, sometimes 20%. But here also we see some people already 40, 50, 80, 90% of them body covered in the burns. So they're very, very serious, and then in different stages of care. We get some people in our corner where they do very well, and some of them will really try to struggle for keep them
Dr.
alive.
Austin Demby believes say the next 30 days na critical moment in the life of the burns victims them because he believes say them people get different burn them with serious and for they in intensive and medical support for the next 30 days.
The next days are going to be critical over the next 7 days because with burns where people are 80% burnt, where there's 70% burnt, where there's first degree, second degree, and third degree burns, you're worried about infection. You're worried about other complications that will go on. So we're going to intensify our efforts over the next 7 days to stabilize these patients. The next 30 days are going to be really critical as they move into the stage of rehabilitation. So it will mean a lot of plastic surgery. It will mean a lot of operations on these people to repair, to make, to bring them as close to normal as possible. It will mean multiple surgeries. So the next 30 days are really going to be critical. Beyond the 30 days, if somebody has 1 degree burn or 2 degree burns or 3 degree burns for 10% of their body, it will mean that they will be in hospital for a while.
As Dr. Austin Demby believes say, the fire victim them need serious medical attention inside the next 30 days of their life for their survival and rehabilitation because he believes say them people get serious burn na them body. The hospital secretary na Connaught Hospital, Ibrahim Fode Musa, don't confirm to Radio Democracy say the hospital don't discharge over 20 of the victims them we've been there with them.
We don't discharge about 27 patients. Now we don't discharge. And currently we got 29 patients. They respond fine. We only get 2 with of concern to where then response very slow medically. But we still observe them and we'll see how them will pull out. Okay. But the rest they do fine. Well, clinically then the status be okay because some come in 5% burn, some 10%. Basically, and then fire the way sometimes the heat meet your hand or your foot, but they were fine. So they came in Friday. We put them to bed rest. Saturday, late in the afternoon, we discharge a lot of them. Sunday, we do discharge.
As some of the patients them still lay under medical care, the Minister of Health and Sanitation called on the public for support government, especially for donate blood and other important service them for the Society for Radio Democracy, Musa Kamara.
And the program Good Morning Salon, they continue. And from now reported, we come over to our studio guest, when the Minister of Health and Sanitation, Dr. Austin Dembi, we don't give update so far on how government through the medical sector don't they respond to the survival them from the fire explosion we up in this BNTM. Mr. Minister, before we go, you will talk about the different type of degree bonds from where this incident happen. In any way, when I get a result where they show the different people will go different the first, second, and third degree bond them. Like when I get any data where they will show say that this amount of people get second degree bond and first degree bonds.
Yes, again, each of the hospital, in fact, the one that we still in hospital, now one that we get mostly second and third degree burns. The one that we get first degree burns, usually in a short-term observation, and then we release them as walking wounded. So we get all of the data. So right now, for example, the 29 people that we admit na Connaught, a small proportion of them are third degree burns and very severe burns, but you get quite a few of them where we still manage with maybe second degree burns. We get 14 people in an emergency hospital, but if you need for be hospitalized, it means in a fairly serious illness state you did.
So
usually second or third degree burns.
One other thing will come out from that report saying as everybody did care for support for letting people recover, they need also people for do blood donations. So if people are listening and want for getting your support as a nation, well, then fellow citizen, also for go and waiting for do if you want for give blood.
So I think that's a very important issue you raise, Mabel, because all man they say me not to doctor, me not to nurse, how I go help, or I not get money for give, how I go help. I think one way where you go for help now for donate blood. And as you say, over time, especially when they go begin getting surgery, then they don't need blood quite a bit. Which would they say now for let people we ready, we go call them for going at the different hospital them and work with Red Cross and for get blood drive. In fact, even today, American Embassy, they get blood drive now at the embassy, where they ask all of the embassy staff for donate blood. We don't want overwhelm the system. We don't want all man go there now who already is. But I think so already we would announce small and tell people that outside for go for donate blood. But at any time, if you go to any of the hospital and offer for donate blood, they'll collect blood from you.
All right, so as we continue for talk about the one that we in our hospital, we just shift them a bit again to the one that we already government, been say with advice from the Ministry of Health and Sanitation where you the head. Wanna be advise them for bury the one them we like been die instantly na the incidents we been happen. Let we just look at the procedures them where the ministry been go through, where we make una decide say governments for bury them body then they as soon as possible. We make them be already done bury them people in there.
Yeah. So again, this is a very, very tragic situation for we all. It basically some of the body them burn beyond recognition. Just no means of identification of the on them person. You're able to see the face. All thin burn completely down to the bones in some cases. So they move all the one and go to a mortuary. But when in a mortuary, the mortuary can only take a few bodies at a time. But when you get close to 100 bodies around, they're very difficult for refrigerate them. So they've all been there in body bags, but then we don't begin deteriorate and don't begin decompose. And we're afraid for the public health risk of that to the community when the body they don't begin decompose. So it'd be important, as the president say, for giving safe, dignified medical burials. But again, we want to be sure where you get safe, medical, dignified burials. You want to be sure, say, now every individual you deal with them as an individual. So even though we don't know their identity at this point, we collect some small sample from them, usually a deeper sample, like from cartilage. So we store in which would you use and sample, yeah. So for now later on, you go do a DNA sequence. We go look at the whole DNA for this individual. What you go do, we go look at the relatives them, then people are not their relative them, especially the mama them, and the sister them. And we look for then collect sample them from themselves, small cheek swab. You put small thing in their mouth for collect sample. You go do the sequence for them one day as well. So when you do the sequence for the family them, and you do the sequence for the dead one them, the one when at the match, you will see then 99% up to 100% similar. Yeah. So that way, you go able to say this mommy and I'm picking this. This mommy and I'm picking this. This person and I'm brother this. So that way they really do able to identify them. People are so way burned beyond recognition at this point. So about 75 of them, we buried them yesterday. Was it yesterday or the day before yesterday? We buried them. But what you do, we make sure say each of them body are so we get a unique number, unique identifying number. Where we go, now we not do mass grave, we do individual graves. So in each of the grave, we make sure say an individual there inside there, we get this unique identifying number. So we'll do the DNA sequence, we'll be able to match them with their relatives then, and able to identify the person.
From that time where the incidents happen, most people always still don't know whether or not their relatives can be involved in the fire. Some are not still see in people they meet and still they search whether or not they be part of it. And you see some people born beyond recognition. So from the one that we born way, but 75 we make mention of where governments are already buried, we be beyond recognition. Anyone did the way unable for know if not picking, when I get numbers. Sometimes when I know say this all they born beyond recognition, but when I go know if not picking on a big person when I been classify them that way there?
Well, it not go necessary because I think so what you look for now the unique identifying information. If you get the unique identifying information, you link them back to the relatives, then will tell you the person's age and that status. So right now, on the identification side, number now we really they focus on. And by the way, as we said, about 130 people that they don't die so far collectively, and some of them die on the spot, but some people then they will die in a hospital, where then relatives and still recognize them. So in fact, of the one them we die initially, about 12 of them they will be recognizable. So the one and they will give the parents them, the family then the option for either take the body or let the state bury them. So for the one there, so we unidentifiable, we feel say over the next few weeks and months, we're able to identify them as closely as possible. We get active surveillance as well. Now with the information fresh in people's mind, we get surveillance officer there where they talk to all of the relatives for enumerate them, for count them, for log them, for register them, and for collect samples.
Dr. Austin Dembi, before that commercial break, they talk about the DNA process. We say the many scanning patterns and they do for able for let people help for know the one that older than die beyond recognition, but still not able for TS them, family members them. And we're also aware say some people we involved in that particular unfortunate incident day. Now people were just caught up in traffic and some are not even stay around the Wellington axis. Just be for user routes they for going at different places them outside in the state. So what's they do for now the procedure for let the family then go through for let they able for reach out to now for do the swap or you say they take for do the DNA if the people them not there around Wellington at all.
So again, I think they will work very closely with the National Disaster Management Agency. They now set up a site, an incident management site at the Wellington there. So I think say any family member we're not sure, you can go ask there and perhaps register your loved one, and we'll try to manage them from that. Then go inform with surveillance officer and irrespective of who side and the surveillance officer that will go meet them, they will interview them, they'll collect samples and from them. Again, the bulk of the patient, the client that will deal with, then they're around the Wellington area. Obviously, some people and we know they Wellington, but I think they're not the minority. We try for cover as much as we can, but then get an incident site now Wellington Day right now, where anybody we you don't look for your loved one, we not see them from Friday, we you not sure, go register, let them get their name.
So,
over at the
Doc,
center.
this DNA tracing for lady one who don't die, unable get them family relative them. I mean, a procedure will get for take a lot of time. How this procedure get for Talik, and when the result here will come out, we will match for no who that die and who that and the relative to this possible die in the fire explosion incident.
Okay. Again, just in line with what the president say, for everybody, one give them the requisite dignity. So we individualize this. So again, as I indicated before, we they get unique number for them. So right now they map the whole grave site, then get each and every grave numbered, which would make sure now say over the next 2 or 3 days, then they use that map they for put in a temporary ID plate in that particular grave site. It will take some time. Then they send the sample and go US for the analysis. The DNA sequencing a very, very complex process. And they collect sample then from all the relatives there as well and send and go to US. Reputable global company will go able to do this work. It will take some time, but we get temporary placeholder them, and over time we don't match individuals. We will make and turn it over to the family. They will build permanent structures. They will build permanent grave site. We'll create down there for them.
Looking back at the survivor them, some of them they in critical condition. Maybe as time goes, more that get for the within the survivor them. This procedure we talk about DNA tracing of the one owner already done very affected from the fire explosion. Now the same one I get for use in the one them way still in hospital, but later then self get for die.
No, because I think say the DNA now for people that way you know get other ways of identifying them. People that way in hospital now, then family and they go fend them, then family and no say then they take good care of them. So I think they don't need DNA identification. This DNA tool now for just EPI for identify people that way will not get other ways for identify them.
So far, our data they show the gender of woman and man they were more affected, especially the one them way on a dumbbell.
Again, the emergency one that we bear them burned beyond recognition, and I think say the pathology group in the do general allocation of sex, but I think say they'll wait for the final results. We go really equip for analysis. This is now an evolving space. We learn new things every day. Low no project the disaggregation between the sexes. You very likely say this why most of them will be male, but then our speculation in part. Low wait let the data tell we what's in happen.
So from where the incidents happened on Friday last week to now waiting at the different supports them we Salon don't get from international partners them.
I think so first we get for start with local partners. Nearly every organization, I saw the National Disaster Management Team say, we want to document every gift we receive in cash and in kind and in material. So we really pleased with all them people and they bring a gift. But are they big? Say we didn't bring in gift here, let them document them. Elect now one case water you bring and document and say we agree one case water. Most people then prefer for take the gift and go now Connaught directly or at the hospital directly. I think say that they fine, but I think say what you do with Connaught now for say let them receive the initial gift, then what they able for store, let them store, what they able we get big warehouse that work in store and them for them temporarily and then go draw on them as time goes on. So we don't get a lot of support from internal, but again this now evolving space, you will need more support as we go along. Internationally, I talked to Padin in WHO, both WHO Geneva and WHO Brazzaville, in less than 24 hours, then saying we 6.6 tons of supplies. I tell plenty thank you to the government and people of UAE and Ambassador Rashid Sissi, we did it, we ambassador, we did it. He just go, he plead with case, and the president called the leadership of UAE directly. And as a result of that, we get 15 tons of supplies we arrive. Again, through WHO, their engagement, we get 11 Senegalese, 9 Senegalese expats that will arrive tonight. The EU themselves come together. Then they send with some experts. The American Embassy makes some donation. The Chinese government give you a large consignment. In fact, a lot of them beds that were able for deploying our Connaught now, as a result of them gift away the Chinese and we get bid them when we bring come from storage. But before we dismantle the bed and try for reassemble them, the Chinese with the bed that we then bring it easier for setup. So now we use for utilize. So we get help from multiple sources then, and a lot of condolences. We really important condolences and goodwill. They come from all about. Now with the Triforce shift again, we did deal with the biomedical side, and with the support we sister them, the sister minister and our minister of social welfare and child development around the psychosocial support, because we can forget psychosocial support to them patient and also because a lot of people something we not planned yesterday, it just happened to you. A lot of them delirious, a lot of them confused, a lot of them get real mental challenges them, and we try to give them that social support there, as well as their family them, as well as the community, and equally importantly, the healthcare worker themselves, foresee 70, 80 dead body in one day. It's just very, very shocking. So mental support for them, social support for them is also very important.
So in as much as you call for more psychosocial support for the survivors then, and also at this stage of the response, if you for advise people where they listen you, maybe locally or internationally, we want for support, financial or the supplies them where they need, equipment them and other things where they need for attend to the patients them, which one the ministry prefer at this stage of the response?
Well, again, we want both. I think for the material, the change. Now we don't even get to rehabilitation yet. All them people ask where them foot them born, them body them born, then get intense physiotherapy. We not reach that side yet. For the plastic surgeon, you need plastic, you need transplant work. You need skin grafting and all kinds of things. We need help around that. So the material support very, very important at this point, as well as the technical support, the financial support. I think they really ask for any financial support for go through the disaster management agency. In any case, we will make sure say for public audit purposes, all then gift here need to be documented. Okay. Especially the cash gift that we get for documented. Even the material gift that then get for be documented because they're intended for them people there. So allow make sure say reach them people there.
Okay, continue for the inside the program. Minister of Health and Sanitation, Dr. Austin Dembi, we don't give updates so far on our government don't respond for treat survivor them we still in a hospital where we get affected by the fuel fire incident explosion we happen in Eastern SPNTM.
All right, we look at the program Good Morning Salon. They continue. We look at messages we don't send so far and questions where people don't ask for the Minister of Health and Sanitation. The very first one they look at from Facebook for S. Augustine. They ask sir, how samples of the dead can be taken when they don't have any fluid again.
This other one from the Facebook page where Charles Kano send the say both materials and financial support are needed to expedite the recovery of these victims. All right, Fritam Babode asks, so we do not have any DNA sequencing facilities in the country. They have to send all those specimens, then they have to send all those specimens to the US. Another message is say, Dr. Austin Dembi, apart from the fluid, even the body and any part of the remains can be used for testing. All right, to look at more messages, and they ask, can you please ask the minister to tell listeners and the public how many walk-in ambulances does the ministry have? Because to our knowledge, we saw videos of people taking bikes and kekes after the incident. This one from Albert to say, Mr. Minister, please tell us how you would have managed this catastrophe if it has happened during the height of the COVID-19. Also, mindfully of the fact that the COVID-19 still exists, is that also monitored at the moment? Watu Ibrahim na Facebook say, thank you, Mr. Minister, for the proactive measures. But my worry is, let's try as a country to improve on our preventive mechanism rather than reactions. To me, this incident would have been avoided if the authorities could have taken steps right away
At the moment, the so-called driver escaped to report these unfortunate happenings. For example, the whole area would have been barricaded.
Another message from Kebike on Conte de say, kudos to the United Arab Emirates for this wonderful donation to our country and also to our healthcare workers for saving the lives of our brothers and sisters.
This other one from Thomas Rogers, he said we must commend our health sector workers, doctors, nurses, etc. for their prompt response and willingness on duty, especially those on leave that came out to help this patriotism and duty bound. Kudos. Hopefully, government will increase your budget to the health sector and give our dedicated health workers good, deserving pay and equipment to work.
Another message, they say, guys, let's stop the blame game. This is the time for us to work with government to save the life of our brothers and sisters. Help by donating blood. This is not the time for politics. Let's pray for the departed souls. Excuse me. And remember those admitted in the hospital for our prayers.
All right, because of time, the final one we may go look at, Albert Fuji on Facebook. It says, sir, I commend you for using the DNA swab. Don't you think it's time to start implementing the unique identification on every citizen? This DNA type could be tied to his or her national identification number. Start with the kids from 0 to 10.
The last one they say people should learn from this incident and also learn to listen to people when they advise or guide us on something. Well, with a message in the form with Facebook page, we come over to the Minister of Health and Sanitation, Dr. Austin Demi, for respond.
So first on the sequencing, we get sequencing capability in Salonia, the lab Laka, the lab na Joy, the lab na Kenema. They're all able to do sequencing, but usually the sequencing and what they do now for small segment DNA, so more for diagnostics, for HIV, early infant diagnosis, for looking at some of the small sequences for COVID-19. But for forensic DNA sequencing, it requires a little bit more expertise. So what you would do now for use this as an opportunity for train with Sierra Leonean counterpart and for do this. So all the sample I would send with this keep aliquot in there, and hopefully over time we'll go for building capability now. So the question about COVID-19, COVID-19, we still to manage the third wave. The numbers don't begin to go down considerably, but even as we speak right now, we get an active surge for vaccinations for COVID-19. My biggest worry now what's going to happen around Christmas time, where people in the camp from all over the world and they come holiday and they go now all remote sites of the country. We don't know which kind strain of COVID will come this time, because we see last Christmas when the numbers spiked considerably. So for we in our salon now, we strategy now, if we want to enjoy Christmas, if we want to enjoy the holiday, and now for protect ourselves, and now for get vaccinated. So right now we get intensive phase 20-day vaccination campaign. I think so they're about day 10 now. So any side, any hospital, all the facilities so we are available to you for all get you vaccine. The vaccine free, the vaccine day, the vaccine enough. Let we go out and get our own vaccine now so that we'll be able to enjoy the Christmas break.
Doc, people feel say because of this incident there has been a divert of attention on the vaccine. It's now more on this disaster will happen.
Well, again, let me just be mindful of that, because all healthcare need for go on as normal. We need for make sure we protect the baby there, we protect the belly woman, we treat malaria, we manage HIV, all them things they need for the go on. Again, this called surge capacity. We're able to expand the surge for respond to this, but we not forget the regular healthcare. So again, I would advise all people that way they utilize the services for continue for utilize the services. The nurses, them, and the doctor there. Again, this is a good time for say thank you to them, because then they work not only for respond to the situation, but they also then they try to take care of the regular healthcare needs.
Very important question become again. We get to deal with the status of the ambulance them, because I guess you have been see some of the video them where the incident be happened on it. So currently, if the Ministry of Health and Sanitation they respond to them kind of disaster, so waiting at the status of ambulance in terms of numbers and how functional them be?
Yeah. So we get two categories of ambulance. You get ambulance that we're stationary at the hospital themselves, and then we get the Emergency National Ambulance Service as well. So between the two of them, I think we get very, very good coverage. Unfortunately, some of the fleet, they don't begin old, they don't begin deteriorate right now. So in fact, right now we're in very active discussions with the National Ambulance Service to see how for completely revisit we ambulance service. Right now they talk to the World Bank for help with some of that support for the ambulance service. So I'll not get exact numbers for you right now, but clearly the National Emergency Medical Service now an area where we're going to need some close attention because I think in all them cases, so we need referral for even with basic care. We need referral them from peripheral health centers to secondary and tertiary hospital them in a very consistent, systematic way. In a lot of cases, we get situations where they can say, fear not there or the ambulance on book, no one for address all of that systematically. In fact, we're in active discussions with the group right now as to how for recapacitate, how for revamp, and how for really reactivate this. And perhaps this incident will occur show in very good light the need for an effective ambulance service.
So sorry, Satula, just
Okay.
the reason why I really want to let you explain more about the issue we get for the ambulance, because since after the Ebola outbreak in 2014, we been see governments at that time they say Salone need for get a national ambulance service, and we even see at some point after the response to that particular outbreak, they now UE building some ambulance them been packed there. Time go, we know they see the game some pack, but not the function at all. Don't think up till they don't all employ. So now that make go really find the listeners and know waiting at the status of that particular national ambulance service there, because it don't take years where we don't hear it from the ministry say when they negotiate, when they talk with our partners them, but still we are yet to get it working. And if a staff lie incidents of that kind of nature happen again, we go still get from one as a country, we not get ambulance them for respond.
Yeah. So again, I walk around you building all the time. I not see no ambulance
Before you
there
they come.
yeah.
Before you they come.
But I think so. What's happening? We can get a really large fleet of ambulances. We come around the end of Ebola,
Yes.
and the ambulance service. I mean, they run them through an international partner, Quam, where it been run the ambulance service. But lately, they now established the National Emergency Medical Service, where take over all of the ambulance service. Again, as I said, they get two components of them. Some of the ambulance then park inside the hospital then, so that the hospital will get access to them. Then the NEM service, now one way they call in.
So then be able to
ambulance.
respond that the way the incidents happen, like for come out
Yes,
and
they can get ambulances, a lot of ambulances, but not enough. And in a lot of cases where you get any kind of emergency, and some people are not able for beer, then they look at the closest, the best way for move people them along, and that then try for do. And in any kind of situation, there are times in much more harmful way. For example, burn victim, you put on Okada. I mean, the trauma associated with that in a really bad way. If you wait for the regular professional people who know how to handle burns, we get the requisite blankets for cover them. We get the requisite way for care for them before they can go to hospital. It will be a better service. But again, this is not something we will work on, and maybe I'll assure you, say, this is not a priority for the government, and with the work for rehabilitate, for rejiggle the NEM service, both in terms of equipment, the ambulance themselves, both in terms of their maintenance in the fleet, and both in terms of the services whether they deliver. I mean, we know only Bella woman need for deliver, and they call ambulance, it take 1 hour for a show up. That ain't enough for happen at all. We get timelines associated, we get turnaround times, or they insist on, we get benchmarks what they create for this new National Emergency Medical Service. And I'll just say level patients, small bit number, and see how will they revamp this. Even start with a lot of ambulances, but the ambulance not only part of the solution.
Okay.
The system for able to get emergency response is equally important.
Doc, in this particular time, the kind of information and message where people get very important. How the ministry with the other body them, where they handle this particular issue going to see the message and where they come out whether on social media and other platform be consistent and accurate.
So again, I think this is a very, very important thing. The one document we everybody for look out for the situation report.
Okay.
So in fact, this midnight, and they released the second situation report. You get all of the most reliable data where a person need, where you can react to. We already involved in this. And then now for the look for.
What's
So
on
in
they
fact,
put on?
in fact, what you will do now for make sure you publish it at the Ministry of Health website and the National Disaster website. And as you as journalists will really try for make sure when I get access to that on a regular prompt basis, which I'll ask the public for also do, and all careful with just some of the so-called journalists there with it tell their story also, because the story then so one-sided. If you go interview somebody, you're able to in situation and see that the hospital not do this, the hospital not do that. Just take the moment for go ask the hospital their own side.
The
of
social
the story.
media journalism, you mean?
Yes, on the social media journal. That one guy they been say, nobody not take care of him, he get for pay money and all that. Well, no, go Rokupa, then go dress you one, then go change you one, then go take care. Beds are available there. If you not go there, we cannot force you. So if somebody they get then kind of report yourself from the media, go back na Rokupa and say, na so they which na in your own side of the story.
Okay.
And it's not fair for let a medical worker they do so much, then somebody just go get this false biased information will not reflect what's happening in the real world.
As to the wrap up the program now, whose message of hope you left with the family members, them, with their loved ones, them still in hospital in critical condition?
Yeah. So first, for all the one and we lost lives, with deepest, sincere condolences to them. We're all day in this in prayer. This is not Salon tragedy, not so one family trying. We're all tragedy. And which even they say they make a commitment, a real commitment to Salon. Say they want and we day and we care. The doctor there and the nurses and then will do everything in their power for care for them. Okay. And we said we'd look for external partners that will all come together and work on this. I know say Boko people and they for blame Boko people, but this is not the time for blame. This is not the time we will all for come together as one nation for care for each and every patient within our care.
Thank you very much to you. You'll be with guest inside the program this morning, Dr. Austin Dembe. Well, at this edition of the program, Good Morning Salongo Lefiu, and today inside the program, we talk to the Minister of Health and Sanitation. We can get updates but mention them where government put in place for treat people away born at the field fire explosion. As always, inside the program, to the team, Michael Sambola and Alex Lawrence Koma, that then produce the program, DJ Ahmad, give technical support. Moses Kavua make on see we live on our Facebook page. And we will bring this edition of the program, Good Morning Salon, come to you this Wednesday morning. Mina Sapti Kalonda say bye-bye.
And Mabel Kabade say goodbye.